I see clear skin in your future. Hey guys, welcome back. We're just having some fun today. I'm going to be talking about the new MelaB3 serum from Roche-Posay. It is their newest offering to help treat excess pigmentation and things like melasma on the skin. This is the bane of existence if you have it, and it's often very difficult to treat. So we're going to dive into this new treatment from Roche-Posay and actually how effective it is. We're going to cover the user experience and talk about why in some ways it's better than even some of the prescription offerings that we have as dermatologists. MelaB3 contains a patented compound that has taken Roche-Posay over 18 years to develop, and it is Melasyl. It is in the MelaB3 serum, and they have made a complementary sunscreen that contains it as well. So we're going to touch on these products today and give you my honest opinion about them. But before we do, we really should dive into melasma, what it is, and touch on some of the other types of pigmentation so that you know how to treat it. It's not just going to be fixed by a single serum, but how to build a skincare routine around treating excess pigmentation. So let's dive into melasma to start with. Now, I probably should mention first that I lasered my face yesterday, so if I look a little puffy, that's why. Now, as far as melasma goes, melasma is a condition that most commonly affects women. It can happen in men, but it's more common in women who have gone through pregnancy, childbirth, who may be on hormonal contraception. All of those types of things can play a role. And what we see is that some of the melanocytes, that's a big word, so melanocytes are the cells in your skin that produce pigment. And some of those pigment producing cells start to overproduce pigment, but they don't do it in an even manner like getting a tan from a tanning bed or at the beach, which you shouldn't do anyway. However, some of them produce more pigment, and the melanocyte right next door might not produce any pigment. And so you get these poorly defined patches of pigmentation that often affect the forehead, the cheekbone area, sometimes the upper lip, almost looking like a mustache, the chin. But in reality, this can happen even on the arms, in any sun-exposed area. And there are some things that exacerbate it, but the truth is we don't really know why some people are prone to melasma and others aren't. But UV light is the main culprit that causes it to appear if you have a predisposition to develop melasma. And so that ultraviolet light leads to triggering the pigment cells to produce more pigment, and they start to produce that in a really uneven way across the face. Even though UV light is the main culprit, we sometimes see individuals with melasma flare just from heat, and there's even some concern if you're especially sensitive that melasma could be triggered by regular light, even blue light, although I think this is a pretty mild concern and most people are not going to be susceptible to it. Ultraviolet light and heat are the main triggers. If you have melasma, it's often going to get worse through the hot summer months when you tend to get more sun exposure, and many people will notice that it fades over the course of the cooler winter months. But if you have a darker skin type, it may not fade even through those colder months, which can be especially frustrating. MelaB3 is an excellent treatment for melasma, but it can also help in other types of pigmentation. And some of those might be post-inflammatory hyperpigmentation. That's the type of pigment that can form after a pimple or a cut or a scrape, where it leaves kind of a purplish dark mark that can sometimes take weeks or even months to fade. This particular treatment for dark spots might also help lentigos. Those are the types of freckles or sunspots that we get as we start to get over the age of 30, 40, 50. So now that we have a little background of what melasma is and what the risks are to cause it to get worse, let's touch on MelaB3 and how to build that into a skincare routine that's going to help manage that excess pigmentation. To build a skincare routine that's going to help limit the risk of developing pigmentation or to get rid of excess pigmentation if you've already got it, the most important thing, and I cannot stress this enough, is you have to be wearing sunscreen. It doesn't matter if we have the best lightening creams or serums available. If you're not protecting yourself from the sun, you're not going to see progress. And if you make progress with a good skincare routine, you can lose all of that progress with just a few hours of unprotected sun exposure. So SPF is your BFF when it comes to treating pigmentation. My personal recommendation, if you have excess pigmentation or if you have melasma, is not just any old run-of-the-mill sunscreen. Oftentimes, you're going to see better benefits from a tinted sunscreen. The tint in most tinted sunscreens comes from an ingredient called iron oxide, and this can be formulated with different tint levels. However, this helps to reflect heat away from the body, because we talked about how heat is one of the potential triggers for melasma. And so we do absolutely want to protect the skin from UVA, UVB light, and most broad spectrum sunscreens are going to do an excellent job about that. But the tinted sunscreens are going to give you a little bit of extra protection against the heat because they help to reflect away infrared rays. Now, even when you're applying sunscreen, you have to make sure you're getting enough of it on and reapplying every 2 hours. That can be challenging, and sometimes the time just gets away from us and we forget. That's why it's also important, if possible, when you have melasma, after putting on a good layer of sunscreen, you should also consider wearing a hat or other forms of sun protective clothing. They even make visors now you can put on that really help to protect the face. Personally, I think they look a little goofy. I don't like to wear them around out in public, but I'm telling you, they do a good job. The traditional treatments for pigmentation include things like hydroquinone, kojic acid, tretinoin, and even topical steroids. Now, I don't like to use topical steroids on the face for my patients because I think that there's certain risks associated with that. Even a lower strength topical steroid, when you use it continuously, can cause problems on the skin. So I tend to compound a hydroquinone and kojic acid for my patients that is a little bit higher percentage, but you have to use it for a short period of time. Now, the way that kojic acid and hydroquinone tend to work for pigmentation, we have to take a step back and look at why and how melanin is made in the first place. We have these proteins, amino acids, these things that will eventually become pigment, and they go into an enzyme, or you can think of it as a machine called tyrosinase, and that starts to push them together and form melanin, or the pigment that will be in your skin. And so that machine, that enzyme, tyrosinase, is inhibited by hydroquinone and kojic acid. So essentially they go in there and they stick up the gears of the machine so that it can't make the pigment. MelaB3 works a little differently. It goes and it catches those things that will become melanin before they get into the machine. So if you think of it like baking a cake, hydroquinone and kojic acid basically make your oven not work. However, MelaB3, that Melasyl ingredient, basically steals the ingredients before you can even pour them into the cake mix. One particular advantage of the Melasyl molecule is that it's safe for all skin types and it's safe to use continuously. If you've ever been prescribed hydroquinone, hopefully you were warned that you can't use it more than 3, maybe 4 months before you have to take a break, because it can cause this rare side effect called ochranosis. That's not fried okra that you're going to get at the Cracker Barrel. Ochranosis is a permanent pigment depositing in the skin that cannot be removed except in some cases by laser treatments. So that is a feared complication of using hydroquinone, and it's why we have to limit the use of hydroquinone, usually to lower percentages for shorter periods of time. But Melasyl is safe on all skin types, and you can use it continuously without fearing that you're going to cause excess pigmentation, significant irritation, the way that hydroquinone can cause. It's just overall a really safe approach to treating pigmentation. The MelaB3 serum also has ingredients like exfoliators LHA, it has retinol in it, and it also has niacinamide at 10%. And when we put all of these together, there's a number of ingredients that are really effective to help reduce the formation of pigment and to exfoliate and eliminate pigment that's already there. So if you're building MelaB3 into a skincare routine, generally you're going to wash your face first in the morning, and then you will want to put on the MelaB3 serum on clean skin. Now, if you want to use a vitamin C as well, you can, and if it's a serum, it doesn't necessarily matter which order you're putting those on. But if we're really focusing on pigmentation, you're going to put that MelaB3 serum on, and then you absolutely have to wear a sunscreen. We already touched on this, I'm not going to rehash it, but you have to put on that sunscreen before you go out for the day. MelaB3 can be used twice a day, so again at night time. After you wash your face, you can put on the MelaB3 and then use your retinol, use a moisturizer. So that is the proper way to include it into your skincare routine. When we look at the user experience of MelaB3, this is a pretty lightweight, non-sticky serum. It feels very nice on the skin, it spreads easily, and the retail price for MelaB3 is about $45. You might find it a little cheaper once in a while on sale, but directly from Roche-Posay or at Ulta, right now it's $45 at the time of this recording. When we look at compounded medications, often they're going to be more expensive than that, and certainly the brand name Triluma compound, which is tretinoin, hydroquinone, and a topical steroid, that can often be more than $100. So at $45, it's not the cheapest serum, but this is a highly specialized serum that is going to help target excess pigmentation in the skin, whether that's melasma, post-inflammatory hyperpigmentation, or just lentigines, you know, the freckles that you get from being out in the sun for a long time. In addition to the MelaB3 serum, La Roche-Posay has also created the MelaB3 UV Sunscreen. Now this is a chemical sunscreen and it is not tinted. My personal preference is if you have significant melasma, I like to be using a tinted sunscreen for my patients, but this is a chemical sunscreen and it feels really nice on the skin as well. It's very lightweight, spreads very easily, and it does contain the MelaB3, so you're getting an extra dose of that Melasyl compound to help target excess pigmentation. This is an SPF 30 sunscreen, and it also contains 5% niacinamide, so again, more ingredients to help fight that excess pigmentation. The best thing you can do is just find a sunscreen that works well for you, that you like to use, so you're more likely to use it consistently. I had the opportunity to go to France and watch the presentation when MelaB3 was officially announced at the Derm Live event last November, and once it was released onto the US market, I've been recommending it for my patients regularly who are trying to treat excess pigmentation or who need to take a break from their hydroquinone. So in short, it is dermatologist recommended. I do advise my patients to use it, and I've been recommending it online through some of the other videos you might have seen on Instagram or TikTok. And if you're new to skincare and you don't really know where to start on building a routine, if you have excess pigmentation, we just talked about how to include that in your routine. But if you're trying to figure out what else you should be doing, I've made a video specifically for beginners to create a simple minimalistic skincare routine. You can watch that right there, and I'll see you guys back on the next video.